All right. Well, it looks like we're at 12:01, and I see some people are coming on. I wanted to welcome everyone. Good afternoon. Thanks so much for joining us today to learn more about VA healthcare and why we encourage all veterans to apply for healthcare benefits and those that you've earned through your service. My name is Dr. Aaron Jacoby. I'm currently the Acting Deputy Chief of Staff for Healthcare and Business Operations here at VA Maryland. I'm here today on behalf of Dr. Vishal Vagela, our Chief of Staff of the VA Maryland Healthcare System. I'd like to start off today by sharing with you the 8 locations in Maryland where veterans can choose to receive care. Many of you already likely know that we have 3 major medical centers. The enrollment information that we're sharing with you today applies to veterans across the country, but for the VA Maryland healthcare system specifically, those 3 medical facilities that we have are located in Baltimore, as well as at our Loch Raven facility and at Perry Point in Cecil County. We also have 5 community-based outpatient clinics affiliated with our medical system, and those are located in Eastern Baltimore County, Fort Meade, Glen Burnie, and then on the Eastern Shore, we have 2 locations, our Cambridge Clinic as well as our Pocomoke City Clinic. When a veteran enrolls in VA care, you can choose the primary site where you would like to receive the care. So if it's more convenient for you, if you're located at one of our community-based outpatient clinics and it's convenient for you to drive, let's say, to Fort Meade, you can enroll in care and get assigned there. We're going to speak today a little bit about enrolling and the process that people use when they engage in VA healthcare. I'm going to turn things over to Ms. Pamela Williams-Dixon from our enrollment eligibility team. She's going to present and provide information about enrolling in VA care, and we'll take questions. Just a reminder, this session today is being recorded. It will be made available on our website within a few days. To protect your privacy, please do not share any personal health or personally identifiable information during the Q&A session. All right, well, let's get started. Ms. Williams-Dixon, the floor is yours.
Thank you so much, Dr. Jacoby. Good afternoon to everyone that is here. So I will be speaking and presenting information about the enrollment process. No one knows veterans better than the VA Healthcare. Enroll today for high quality, veteran specific care. Enrolled veterans are eligible to receive regular checkups. They are eligible to see specialist visits such as cardiology, podiatry, mental health, home health, geriatric elder care, care in the community, urgent care access at over 3,000 plus locations.
It seems like we might have lost Pam. Do folks hear her?
Dr. Jacoby, can you all hear me now?
We can hear you again.
All right,
Thank you.
good. Thumbs up. All right. So my apologies for that. Don't know what happened. But I am here to present on the enrollment and eligibility process and give some information and some highlights. Enroll today for high quality veteran specific care. Enrolled veterans are eligible to receive regular checkups, specialist visits such as cardiology, podiatry, mental health, home health, geriatric elder care, care in the community, urgent care access at over 3,000 plus locations, and more. Access prescriptions, prosthetics, and medical equipment. And all of these are benefits you all have earned. Myth versus fact. Debunking enrollment myths. There are a lot of things that we hear and veterans hear that are not true. So I'm going to share some of those myths and then I'm going to do some fact checks. The first one is I didn't serve in combat. I wasn't injured in the service, so I'm not eligible for VA healthcare. Fact check for that is if you serve in the military, even during peacetime, in the active military, naval, or air service, and are separated under any condition other than dishonorable, you may qualify for VA healthcare. The next myth is one that I've heard so often. I do not want to go to the VA because I want to save those appointments for those who really need them. We receive funding based on the number of veterans who use our services. By choosing VA for your care, you're not taking away from others, you're helping expand access for every veteran. I want to go to the VA, but I do not want to lose my private health insurance. Don't worry about that. This fact check says, assuming you are eligible for VA health care, you do not need to give up your private health insurance. You can keep your private insurance and VA health care too, the best of both worlds. I make too much money, so I have never applied for VA health care. Eligibility isn't just about income. There are many other factors into consideration when applying for VA healthcare, including service-related conditions, time and location of service, and more. I have a service-connected rating or disability rating through the VA, so I am already enrolled. So am I already enrolled in healthcare? Truth is, disability benefits don't automatically enroll you. You must still apply for VA healthcare. The good news is that a service-connected disability is a qualifying eligibility factor. Choosing VA means you get everything you need in one spot. VA's comprehensive healthcare services can improve your health and well-being while saving you thousands of dollars per year. Even if you don't need this care today, you may need it tomorrow or the next day or 20 years from now. And once you're in, you have access for life. What could VA healthcare mean for you? Comprehensive healthcare, from preventive to specialty care, no insurance needed. What your doctor recommends is what you get. Vision and hearing care, exams, glasses, contacts, and hearing aids for eligible veterans. Mental health and whole health, support for your mind and overall well-being. And I think this is very, very important here. Can we go back? I just want to put this tidbit in. And all we do, we want to support the psychological stress our veterans may experience when it comes to their health care. Next slide. Urgent care access. There are 3,000 plus locations nationwide. Virtual visits, see VA providers from home. Prescriptions made simple, filled at visits or mailed to you with easy refill options. VA Health and Benefits app, schedule appointments, fill prescriptions, and manage benefits online. Travel reimbursement. Eligible veterans get paid for miles to and from scheduled appointments. Easy check-in, no forms, just your VA ID. Community care, be seen in your community if VA care is too far or not available. Dental care available for those who qualify. Learn if you're eligible for VA care. Your service matters, so does your health. If you served in active military or reserves or National Guard, called to active duty by federal order and completed service, even during peacetime, you may qualify for VA care. What you'll need to enroll. Before you start your VA healthcare application, have these ready. Discharge papers, DD-214, your most recent tax return, Social Security numbers for you and your dependents, insurance card details if applicable. You're covered with VA healthcare. Get peace of mind, enroll today. Apply online. There's a link there provided for you to apply online. Apply by phone. You can call the toll-free number, which is a secured enrolled telephone line. Apply in person. You can always visit the Baltimore VA Medical Center or Perry Point VA Medical Center, where one of the well-knowledge and well-rounded enrollment clerks will be able to assist you. Apply by mail. You can download and complete an application for health benefits. Mail to Health Eligibility Center. There's the address there, the P.O. Box 5207, Janesville, Wisconsin, and there is the zip code there. After you apply, you'll be notified within a week. Here's what you can expect after you apply for VA healthcare. Within a week, you'll get a welcome call to schedule your first appointment and ask questions. No waiting, no wondering. Confirmation letter with details on next steps. VA benefits handbook that explains coverage, copays, and priority groups. Now, if you haven't received that in a timely response after submitting your application, then you will want to give the toll-free line there, which is to the enrollment center. Are there any questions at this time? We're here for you.
All right. So thank you so much, Pam, for giving all of that information and reviewing the information that's here. We are going to leave up this slide here with contact information for the subject matter experts, just so that you know kind of who's on the call and who might be able to answer your questions today. We're going to now transitioning to the question and answer portion of our session. Just a reminder to protect your privacy. Please do not share any personal health information or personally identifiable information. Feel free to post your questions into the chat, or if you can't access the chat, you can email questions directly to VAMX Public Relations at va.gov. I'll repeat that. It's VAMHCS public relations at va.gov. I'm also going to drop that address into the chat so that you can see it if for some reason that was hard to follow. So let's open it up for questions now. I'm going to see if there's anything in the chat yet after I drop in the email address. Put that right in there now. Okay. So, a question in the chat, why does VA require financial information from eligible veterans? Joe, that's an excellent question. Pam, did you want to talk a little bit about the reasons why we need to obtain financial information from our veterans? Can you hear me, Pam? You're on mute if you're talking. All right, well, it seems like Pam's not able to get off mute. So one of the reasons why we obtain financial information is we need to do what's called a means test. The means test essentially allows us to understand what category of care you'll be assigned to. There are some veterans who earn a certain amount of income, and that would result in possibly owing some copays for services. So the reason why we get the financial information is we need to make sure that you're assigned to the correct band of care. Many veterans that enroll in VA care have very limited or no copays. That's often based upon service connection status, as well as other conditions. But that's in the nutshell, the reason why we request financial information from folks. Okay, looks like Barbara has another question. How far do you have to be from a VA medical center before you are allowed to go to a local facility instead? So that's an excellent question, Barbara. And I will say that many veterans have questions about eligibility for care in the community. There's a lot of different factors that go into determining the eligibility of how far you need to be. There's drive time eligibility. So essentially, um, we calculate how much time it is from your home to the community provider, and we also compare that to how close you are to the facility. And there are, if you're a certain distance away, you can be eligible for care in the community based upon drive time. There's also another category that many veterans have been qualified for called best medical interest. And best medical interest means that if we do not have a service, a provider that is able to provide the care that you need, even if you're not drive time eligible, you might qualify based upon best medical interest. Essentially, the physician is saying that you need this level of care, and the only place that you can get that is in the community. Under those circumstances, you'll be eligible for that care. And once you receive approval through care in the community, there's an authorization number that's generated, and the community care provider will use that number to ensure that you, when they're billing, that the VA pays for those episodes of care. Just a reminder, it has to be an approved and authorized care in the community. Sometimes veterans will come back to us after the fact and they'll say, I received care in the community and I'm wondering if the VA is going to pay for that. In most cases, the VA doesn't pay for care that's already been provided. There are some exceptions. If you receive emergent care, so if you're out in the community and you need to go to an emergency room because there's an emergent issue, often we can get those types of care episodes covered. And then certainly if somebody is hospitalized emergently, we know that unexpectedly, sometimes we have health conditions where we need to go right to the hospital. And in those urgent and emergent situations, we can often work to get that care authorized. However, if you just contact a community care provider and go and receive outpatient care and it wasn't authorized before, in most cases, we won't be able to cover that. So it's really important to not only speak to your care provider here, your primary care provider, when you enroll in care, about the eligibility that you have for care in the community and that you get that approved before you receive the care. Hopefully that answers the question. I know that there was a lot there. Okay. Next question that we have in the chat is, can we be on TRICARE Select and still have VA healthcare? And then a second question is, VA care specific to diagnosis? So I'm looking to my subject matter experts on the call today in terms of eligibility and enrollment for insurance. Can someone speak to TRICARE versus other levels of healthcare and insurance? Thing I'm trying to see is, are we having mic issues? Can you hear me?
Yes,
We
Dr. Cody.
can, we can hear
Oh.
you. Dr. Gadea, are you,
Yeah, so
you should be able to unmute your microphone?
I'm here.
Thank
So
you.
I'm not an enrollment or eligibility expert, but I'm a primary care physician. And so we do get this question a good bit also. Where folks sometimes will have private health insurance or other healthcare care that they receive outside the VA. My understanding is that if you enroll for care and you're eligible for care with us, then this is additional. This is something that you can avail of in addition to other healthcare insurance that you might maintain outside the VA. But would love to hear from our enrollment and eligibility folks on whether there's any specific guidance regarding TRICARE specifically. But hopefully that
Dr.
answers Mr. Rick's question too.
Dr. Jacoby, I do apologize. I'm in a shared office and there was a lot of construction and engineer noise in the background. But to answer the question about the TRICARE Select, yes, if you mean TRICARE Select for veterans, yes, you can have both. It's called a dual eligibility. So you don't have to give up your TRICARE once you receive VA healthcare if you're approved for it.
Thank you, Pam. And then the second question, is VA care specific to diagnosis? That's an excellent question. So what I will tell you is that when veterans come and enroll into care here, what we're going to do is when they get engaged in primary care, their primary care physician is going to do a thorough assessment of all of the physical health conditions that they might have. We're going to ensure that whatever care you need, we're going to either provide within VA, or if we don't provide that care, we will refer you to care in the community. Some people have questions about whether or not they have to be service connected for certain conditions to receive care. And what I will say is that we're here to provide as holistic care as possible. We don't just provide care for specific diagnoses. We're going to make sure that we provide the holistic care. And like I said, if we don't have something available and you're eligible to receive care in the community, we're going to get you that care. So it's an excellent question. A lot of veterans have that question about whether or not they have to be service connected. We treat a wide array of veterans. Some are service connected, others aren't service connected, but it's not driven by diagnosis. Okay, we have another question here. And Rick had the question regarding 20-year veteran with full insurance from his employer. And he's got the Medicare and the TRICARE. And so I think we answered that you can be dually enrolled. And we do have veterans who will hold TRICARE benefits. They also have Medicare, and we routinely will partner with those organizations to make sure that you're going to get the coverage that you need for the care that you're receiving. Another question we have is, I've been denied VA benefits specifically because of my income. So, Michael, I know that, and I will tell you, the Veterans Benefits Administration and our service representatives at that organization are experts at knowing all of the different permutations of what you need. There are income restrictions. There are individuals who make a higher amount of income, and what that will mean is that they may not be eligible for certain things that are offered through VA. Now, your question was specifically related to denial of benefits based on income. That is a question that I think can be best answered by the Veterans Benefits Administration, because I know that when you as a veteran receive the determination of eligibility for service connection, that document that veterans receive is often very detailed, and it will list item by item the reason why individuals may not have a claim that's supported. In fact, I just met with a veteran the other day who had shared some information that he had received from VBA. He was a little confused about some of the items on there, and we were able to connect and work with folks at the Veterans Benefits Administration to get more clarity. I would say that any questions that you have specifically to claims that you've filed with the Veterans Benefits Administration, there's a number that's always on the communication. And if you dial that number, and I think we're sharing our screen again, you can call the hotline and ask questions. I will also say that many of the veterans that I care for, they often have a personal service representative that they work with, they have a direct connection with, and can often navigate and answer the questions related to specifically service connection claims. But just to circle back, there are some income restrictions, and I don't know, Pam, if you have anything that you'd like to share about income thresholds. I do know that there are certain income thresholds that will only allow certain care to be provided. Pam, do you have anything to add?
Dr. Jacoby, you pretty much gave all the information. There are certain thresholds for income, and I believe that it's 40 to 48,000. I can verify and confirm that with you all, but there is an income threshold that we do use for the enrollment process. However, if there are any eligible factors that are listed on your DD 214, we could use that as well. But again, it all depends on when you apply online or you can come in person to present your DD 214, then the enrollment clerks, we can let you know at that time what, what you may qualify for, what you may not qualify for.
Thank you. Um, there's also a follow-up question, Pam, where Carla says, I noticed it was mentioned that the VID card is needed. She never set one up. Where can she apply/receive specifically the ID?
Okay, you can visit the Baltimore Enrollment Center at 10 North Green Street, or if you're closer to Perry Point, you can go there and apply for the card. It takes about 7 to 10 business days. Once you have taken the picture and they've verified you in the system, it takes about 7 to 10 days for you to receive that card. There is a link that you can also go on if you are not able to actually go in person, and I will put that in the chat.
Thank you. I see Mary had said that you happen to be a little late to the meeting. Can you get this emailed? So the good news is that we're recording today's session, and in a few days we'll post this entire conversation on our website, and so you'll be able to actually play back whatever you missed earlier. So thanks for letting us know. It looks like Charles asked, I once had a VA card in the 1970s. Misplaced it since then, was told since I didn't serve in active combat during the Vietnam era, I'm not eligible. That does not sound correct to me, Charles. Pam, I don't know if you want to talk a little bit about the eligibility for some of our veterans who had served during the Vietnam era. I know that a lot of times people have questions about length of service, how long they need to serve, and essentially when, the time band in which they served. Can you shed any more light for Charles?
Yes, hi, Mr. Charles. As far as you misplaced, you had a card in the 70s and you misplaced it. You can always still apply for the card if you're already enrolled in healthcare. It's just going to be a simple replacement card if you've had one before. We will need your current ID, making sure that it's not expired. You can visit the enrollment center again at Baltimore or at Perry Point, or you can request it online.
Thank you so much, Pam. All right, I'm checking the chat to see if there's any other questions. Oh, we just got some come in. So another question, what's the timeline for enrollment after the expiration of active duty status? So essentially, can you apply at any time, I think is the question.
Yes, you can apply for enrollment at any time after active duty. Just bring in your DD 214 and we can assist you there in the enrollment center. Or you can apply for healthcare benefits online at www.va.gov, and I'll put that one in the chat as well.
Excellent, thank you. And I know Barbara said, did she miss the link to apply for the VA card online? But we'll make sure that we get that link there. Yep, right there it is. Can you just added it for us? And if you do have any problems with accessing the links, also email us. Sometimes there are, some access challenges, but in general, things that we add here should be clickable and it should go right to the link. I wanted to say one other thing related, it just kind of popped into my mind. We had a question earlier regarding eligibility. The one thing I wanted to be clear about, if you come to the VA and you inquire about eligibility and for some reason, you're informed that you're not eligible for care, I want to encourage you to consider returning, in time, certainly if there are any changes. Because sometimes veterans will hear that first set of information and they'll believe that, oh, well, I can't come back. We are always here to answer questions about enrollment and eligibility. And I will say that things change in people's lives. Sometimes income changes. Sometimes, you might have steady employment and then for whatever reason that employment changes. The other thing I'll say is that we are learning more and more about conditions, physical conditions in particular, that are linked to toxic exposure, while in the military. And we do robust toxic exposure screening here at the VA. And sometimes veterans will hear about that. They'll come in, they'll enroll in care, and they'll get that full workup, and then they'll go and they'll say, maybe I should apply for service connection benefits related to physical conditions that I have because I think they're related to my military service. So if a veteran does get service connected for a condition, they can receive care here at the VA. And that actually can be independent of income. We do see veterans who may actually not be eligible from the income perspective, but they're service connected for a condition and they can receive care for that condition. So I just wanted to clarify that there's a lot of different ways that veterans can receive care. And I don't want anyone to think that, well, I was told 40 years ago or 20 years ago or a year ago that I wasn't eligible. If you think that you might be eligible now, please go online, come on in, talk with one of our enrollment and eligibility specialists. They can assist you. Okay. Let's see, we have a few other questions that came in here. Oh, actually, it's all the links. So we have the link for the Veterans Health ID card. We have the link for applying for VA healthcare that's added to the chat. And then we also have a link that Kenya has provided for the services that are available here across VA healthcare, VAMICS in particular. All right. Any other questions? Getting a sense that we're at that pause. So I wanted to thank everyone for joining us today and learning a little bit more about what VA Maryland Healthcare System provides. We hope that each and every one of you will take the next step and enroll in VA healthcare and essentially be able to benefit from the healthcare that you have earned and deserve based upon your military service. Please share what you've learned today with other veterans. Get the word out. We are really interested in more and more veterans hearing about what we do here and also providing care because we really value the care that we provide and working with veterans. It's actually what gets me up out of bed every day and here to work is just interacting with veterans and answering people's questions. Remember, you will be able to access a recording of today's session at maryland.va.gov. That's maryland.va.gov, and that'll be available on our website within a few days. Oh, and we just got a last minute question here. Is there a section to apply for vision benefits? And right here, it looks like, oh, that was another chat there. In terms of vision benefits, Pam, did you have anything that you wanted to share about specifically veterans who are interested in receiving, optometry evaluations, glasses, prescriptions, those sorts of things?
Well, as far as the vision care goes, if they do see someone in audiology and that provider says that the diagnosis is something that we would need to address here, and they would be able to get contacts and glasses here. Otherwise, it will still be if you're eligible for it once you're enrolled and we found out your enrollment status. It could be included, or if, like I said, if the provider says that this veteran needs to have contacts, glasses, what have you, then yes, you will receive that vision care.
Yes, thank you. And I would add to that, we do have veterans who receive vision care benefits in the community. Again, once they're seen and approved for care in the community, they can get those benefits. Sometimes veterans will ask us, well, if I went outside and I got my vision benefits, can I then come back and try to get reimbursed for that care? Again, just a reminder, you need to get the care authorized in the community prior to doing that, and then we'll work with you to make sure that you get seen. It's real important to get annual vision screens. A lot of things do change with our eyes, especially as we age, and there are a number of different conditions that if we catch them early, we can provide expert care and help you continue to see it the best that you can. Right. Any other questions? Rick asked, are there benefits for dependents? Excellent question. And I will say that I saw Pam come off mute. Go
I'm
ahead, Pam.
sorry.
No, no.
I'm sorry, Dr. Jacoby. There are benefits for dependents, but that would go through and get authorized through CHAMP VA. We don't do any of the authorization for and eligibility for any dependents.
And do we have a link for CHAMP VA that we can drop in the chat today? I don't have it at my fingertips right now. I think that would be helpful to add. Oh, there we go. Thank you, Ms. Griffin. I appreciate it. So you can click on that link for CHAMP VA to learn about dependent benefits. I'll also add that if veterans reach out to the Veterans Benefits Administration, VBA, sometimes the individuals there can have conversations about other types of benefits that are available for dependents. Oh, we've got another question. How does a non-honorable discharge receive mental health care? So, when you say non-honorable discharge, I think that you're probably referring to other than honorable, because there's a distinction between other than honorable and dishonorable. So, other than honorable, there are actually a number of different things that people can access when they're other than honorable. But the first thing I'll say is that when a veteran comes and presents for care, if they need emergent and urgent evaluation, we're going to make sure that a veteran gets care. So if someone needs to get assessed for mental health symptoms that they're having and they are in an emergency need, we're going to do those evaluations. And I will say that many times veterans who have other than honorable discharges will come and seek care. The other thing I'll say about other than honorable is, I think all of you know, discharge status from the military is something that you can apply to and essentially put in an appeal. You can essentially say, I don't, agree with this discharge. And there are ways for people to get their discharges upgraded. I've seen many veterans over the years who had originally an other than honorable discharge, and they'll get that upgraded to a general discharge. And they worked alongside usually people at the Veterans Benefits Administration to get those upgrades in discharge status. Mental health care in particular, there was an act called the Compact Act, and the Compact Act essentially was signed into by Congress that essentially authorizes emergency evaluation care for mental health, especially if a veteran has, presents with suicidal ideation, they have suicidal thoughts. And we do receive notices from veterans who they can get care that is deemed Compact Act eligible. And we can provide a link for the Compact Act here. That'll provide some more information about how veterans can get mental health care when they have different discharge statuses. Looks like we have some other questions that came in. How long until we hear back regarding acceptance after applying?
It takes about 5 business days. Normally, when you come into the enrollment center, it's actually done right then. You will get your eligibility status right then. If you apply online, the same, as well as going through the telephone secured line. The only way that it takes up to 5 days is if you have an actual application that is mailed in.
Thank you, Pam. There's another question here. Looks like a question from Walter. If a female gets married after service, does she have to use her maiden name? I'm not aware of any reason for that, correct, Pam?
I'm not aware of any reason for that as well.
And then dental benefits. I know that we have many veterans who have access to dental benefits. In fact, recently learned that a larger number of veterans are eligible for dental benefits. Pam, do you want to talk a little bit about the ways that people can apply for dental benefits when they come into enrollment and eligibility?
For dental benefits, you have to be totally and permanently disabled through the VBA as far as their concern is in order to receive dental benefits. We just received on yesterday afternoon some other dental information, and it will ask us, did you receive on your DD 214 if you received a dental evaluation when you discharge or before you discharge from the military? If it's marked no, then we will go into our system and it will give us a 6-month expiration period that you can, receive dental benefits for. But that is what we just learned on yesterday. So I'm not all too familiar with that part, but I do know that if you're 100% service connected and you're classified as totally and permanently disabled, you have dental benefits.
Thank you, Pam. Joe has a question. Do we need an appointment at the local centers? Joe, do you mean at the VA, like the 3 major medical centers in Baltimore, Lock Raven, and Perry Point, or are you speaking about the community-based outpatient clinics? Or is that an enrollment question? Are you asking, do you need an appointment to come in to enroll? Oh, where you can get an ID. Excellent question.
The hours for the enrollment center to receive an ID is 8 to 4:30 Monday. I'm sorry, 8 to 4 Monday through Friday.
Thank you, Pam. And no, you do not need an appointment prior. You can walk in, correct, Pam?
Yes, no appointment needed.
Okay, and then Vivian asks, just to be clear, a person can only get an ID card after first applying for and being approved for VA healthcare. Is that correct?
That is correct. You do have to be enrolled in VA healthcare in order to receive the ID card.
Thank you. Oh, it looks like Andrea has added, for dental, the VA office told me to go to this link to apply for VA benefits.
That is Delta Dental, and that is who we refer veterans to if they are not eligible for the dental benefits with their eligibility. So yes, that is correct.
Thank you. Right. See, I was too quick before in trying to wrap up. I'm going to give a little more time now as people think of questions. Don't be shy. Feel free to put something in the chat if you have any other questions, or if there was something that we had given information about that wasn't quite clear, we can also clarify.
Dr. Jacoby, I'll just pop in here and say one more thing too, if you don't mind.
Of course.
For those of us who have joined us today, we appreciate you being here. And we do want to ask as well, if you have any friends or someone in your family or any other veterans that you may know who have not been able to join us today or who don't know that they might be eligible for VA healthcare. We always say, please tell a vet. Please feel free to share this information with them, to encourage them to apply, because we'd really like for all veterans who served to know that they should apply for VA healthcare. So thank you in advance for helping us spread the word.
Yeah, I can't echo that anymore. We did see more veterans last year than we did the previous year, and we're looking forward to doing that again and seeing even more veterans at our facilities. Looks like Joe has a question here. The ID card is specific to healthcare. Yes, that is, there isn't a general VA ID card and a healthcare ID card. Great question. Yes. The ID card is specific to healthcare when you enroll. Another question, are you able to enroll whilst you are still active? Oh, that's an excellent question.
You can't actually enroll because you are active duties. You have to wait at least 1 day after you have been discharged. You can actually submit your enrollment application, but once your future discharge date has come off and you've been discharged, you wait 1 day and you will be able to apply.
Now, follow-up question, Pam. Let's say a veteran was enrolled in VA healthcare. At that point in their life, they were maybe in inactive status, but then they were activated into active duty status. Do they have to wait or are they already enrolled? That's my question.
So your question can, Dr. Jacoby, they were inactive at one point?
Yeah, so sometimes veterans when they come and they enroll in care, they might be in like an inactive ready reserve and IRR status, and they'll be in that status, sometimes up to 6 years, and then events change and they get reactivated and they're in active status. They don't have to reapply. If they've already enrolled in VA, they're in, right?
They're enrolled if they're already receiving the health care, but they do need to update their means test once a year. So that will provide us with the information that we would need to carry on for their healthcare benefits. So if they have any changes, yes, they will have to do that. The only priority groups that do not have to update their means test is if you are in a priority group 1. You do not have to give us your financials, but any other priority group, you would need to provide us every year with your financials, which means doing a means test.
Thank you. That's an important clarification, and it is an annual requirement for folks to do their means tests. So, James asked, will today's presentation be available afterwards? Yes, James, we are recording today's presentation, and we will actually post the recording of today's presentation, which includes all of the information, onto our website. It'll probably be available in about 3 days, so it'll take a little bit of time. But you'll be able to listen to the entirety of the presentation. You'll also be able to see all the slides. You're welcome. Right. Vivian asks, if my last name on my DD-214 is different from my current last name, do I need to submit documentation along with my application? That's an excellent question, Vivian.
Yes, you would need to submit documentation with the application with your current last name.
Any other questions? Oh, and thank you, Ms. Griffin, for putting in the information regarding the recording for today's presentation. Will be available next 2 to 3 days. Thank you. Oh, and then Charles has a question. The VA resource sheet says you've enlisted after September 7th, 1980, or entered active duty after October 16th, 1981. And then goes on, You served in certain locations and time periods during the Vietnam War era. This indicates that outside these criteria, and I don't see the rest of it, are not. Let me scroll down here. I didn't get all of your message, Charles. It looks like this indicates that outside these criteria are not maybe eligible.
I'd like to chime in on that, if you will, Dr. Jacoby.
Yes, please.
Mr. Charles, the resource sheet is partially right, but that's why we asked the veterans to come to the enrollment center along with their DD 214. There may be other eligible factors that can make you eligible for VA healthcare.
Yeah, I echo that, Pam. When in doubt, come into the Enrollment and Eligibility Center. Our staff are wonderful at walking you through any questions that you have. And you don't need an appointment. You can walk in. Any other questions that folks have? Oh, no worries, Charles. Sometimes when you're chatting and things, it doesn't all go through. That happens to me all the time. Any other questions that folks have? We've got a little bit of time left today.
Sounds
will
like
say-
that might
go
sounds like
ahead.
that might be it, Dr. Jacoby. I am going to put up here that contact list with the local contacts for anyone who didn't get a chance to take a look at that. I did make some updates after we started, so please do use the one that I had just put up there, and then I'll turn things back to you, Dr. Jacoby.
Sure. Well, again, it's been a pleasure talking with all of you today and sharing a little bit about the resources that we have here at VA Maryland Healthcare System. We're hoping that you'll get the word out. Echoing what Ming had said earlier, we want to make sure that you can take the knowledge that you learned today in today's session, as well as all the links, and share that with other veterans. We're here always to answer your questions, and it's an honor and a privilege to provide care for you when you enroll in care. Feel free to use the links for phone numbers, as well as looking through the information online. And we are always here for you. So we hope that we'll see you soon once you enroll. And if we've already seen you, we hope to see you again. And we hope you have a fantastic day. Bye for now.